welcome everybody to one of our next AAPM&R Content Creators Workgroup presents amazing speakers that are going to be coming to the AAPM&R. Today, I'm joined by Dr. Jennifer Hankenson, who is from Yale University. Before we begin, I wanted to introduce myself. My name is Ravi. I'm a doc here in Chicago, Illinois at Rush University Medical Center. I'm also the program director here, and I have also joined the GME committee at AAPM&R, where I'll be the chair the next year. So I'm looking forward to all the great work that we're going to be doing at the AAPM&R for the next couple of years. Dr. Hankenson, would you mind introducing yourself?
Yes, so I'm Jennifer Hankenson, and I serve as assistant professor of orthopedics and rehabilitation, and am program director of the PM&R residency at Yale New Haven Medical Center, and board certified in physiatry and lifestyle medicine, and I'm passionate about advocating for patient care and resident education.
Amazing. Now, a lot of people look at lifestyle and they think, gosh, that's an outpatient thing. And we're here to talk about inpatient rehab. So how do you incorporate lifestyle medicine into inpatient rehab?
So I actually think it's a really great opportunity when patients are in an inpatient rehabilitation setting to really start the conversation about lifestyle changes. It's a very vulnerable time in people's lives, and oftentimes they're looking to see what are the best ways that I can prevent myself from coming back into this setting again. So I think starting the conversation and really doing it in a way that you can motivate patients when they leave to really continue the changes that they're making while they're in the inpatient setting. So I find that it works well. I think it takes a little time and thought, and so sometimes when we don't have enough time in the day, that can seem challenging, but I do think it's a great setting to really introduce the concept.
Absolutely. And I think you and I, as both two inpatient people, know what a great relationship we can establish with people over a 2 to 3 week period. And for me, sometimes when you talk about counseling people to right that ship, it's inpatient when we can create those opportunities and those long-lasting relationships. So all those folks that are thinking of lifestyle, it's inpatient rehab, maybe a great opportunity for them to incorporate it. Now, I know, I was reading through your biography and I saw all the amazing stuff that you like to do, but everyone always wants to know, what do you do for fun? How do you find that balance? How do you find that happiness outside of work? What would you say to that?
So I love the outdoors and I love spending time with my family. And sometimes I get to combine the two. I really love the sport of tennis. So when the weather is great, and I live up in New England, when we have our warmer weather, you'll usually find me outdoors playing some tennis matches. So really though, anything that takes me outside usually makes me pretty happy.
Now, as a tennis player, what are your thoughts on pickleball? Are you one of those converts that's going to be playing pickleball more than tennis in the future?
At first I was really hesitant against pickleball, but a few of my friends have challenged me to some pickleball matches, and it's actually pretty fun and it can get pretty addictive. So um, I haven't written it off just yet. I still think the jury's out, though. I've seen several people get some pretty significant pickleball injuries. So, maybe you just need to be careful about your form when you're playing.
There we go. Okay. I'm someone that needs to pick up something new, so I'll have to take your advice, maybe tennis over pickleball for now. Now, we're here to
Great.
talk about the amazing work that you do at the Academy. You have two incredible talks, and they're part of the Advanced Clinical Focus talks. They're going to be on Thursday, October 23rd, 2025. And do you want to just talk about the two talks that you're doing, just so we're familiar and get excited to come and see you speak?
Yes, for sure. So, my first session is the called Breaking Barriers: Effective Rehabilitation for Patients with Functional Limitations in the Setting of Obesity. And I think this talk is going to be very interesting because it addresses one of the most common and challenging aspects of rehabilitation, in my opinion, and that's um, addressing obesity in the context of how we can do better for our patients. And I really think the goal is to share strategies that are practical but evidence-based, that, definitely translate to the inpatient setting, but also maybe things that we could help patients as they discharge continue in the outpatient setting. And I also plan to briefly touch on the concept of pre-rehabilitation and why I think we need to look at the inpatient rehab setting. The evidence is very strong that patients who undergo bariatric surgery do very well getting some type of pre-rehabilitation. So I think that's a conversation we can have at this talk. And then my next talk is focusing more on the tech and technique side of things. It's the future of neurorehabilitation. And this session is exploring innovations such as robotics, neuromodulation, brain-computer interfaces, and VR, and how these technologies can be integrated with traditional rehab to improve the outcomes and expand on what's possible for our patients, especially those with underlying neurologic injury or disease.
That's amazing. And in your talks, I know you're at Yale, it's such a great institution, rehab program. For those that may not have the opportunity to plug in with VR, for example, or they might have some financial constraints, what would you say in the way that they can plug in with the utilization of technology in their practice?
So I think a great place to start if you're at an academic institution is look to see if there's a strong Department of Engineering. A lot of my work has actually been collaborating with our engineering department and bringing the researchers into the clinical setting to really allow them to interact with patients and see, okay, they understand the engineering side of things, but don't always get what the patient's needs may be. So I think integrating with an engineering department is really helpful. But then there's also a lot that's available through industry. So you may be able to approach a company. One of the new hotter things is things like the virtual reality headsets, but you may be able to approach them with an idea or research study that they'd be willing to sponsor you or work together in a collaboration. So I definitely think there's a lot of opportunities, even, outside of the academic setting, to incorporate more technology into an inpatient rehab setting.
Amazing. I know those are going to be things that you're going to be talking about in the talk as well. And I'm sure, as you will be able to attest to, is you don't have to be at Yale. You might be in a city where they have a college of some sort with these great bioengineers or engineers that may want to collaborate and saying, "Oh, we thought you guys were going to say no to us, so thank you for reaching out." And of course, industry, they're always willing to want to collaborate. And I'm sure there's going to be a lot of people in your audience that will be willing to be mentors for those that are interested as well. Don't want to put it all on you because you might have 100 people that that need your help. Now, these are, just to reiterate, these are going to be some great advanced clinical focus days on inpatient rehab on Thursday. So we would all recommend you come early on Thursday to Salt Lake City and come to these talks, especially for those that are interested in inpatient rehab. Now, with that being said, I wanted to explore and talk to you about what makes you excited to see people in inpatient rehab now?
I think what excites me the most is the transformation we get to witness. Patients come in at some of their most vulnerable times, and it can really be life-changing for them to spend several weeks in an inpatient rehabilitation setting. We get to work through collaboration with other colleagues and the rehab team. And I think that combination of both the art and science of medicine is really, to me, very rewarding. And I love to watch patients progress and that resilience, despite, sometimes overcoming very difficult and challenging health battles. It's really an honor and a privilege to get to see my patients recover.
Absolutely. You're preaching to the choir. I love it. I think one of the reasons why I want to ask that question, because I'm excited to go to inpatient rehab every day, but there's this feeling that not enough residents are as inspired as you and I about wanting to do inpatient rehab. Do you feel like the interest is waning or it's harder to find residents that want to do this as a career?
So I wouldn't say necessarily that the interest is waning, but I do
Mhm.
think it's evolving. I think residents are definitely drawn to the newer technologies and procedures, and inpatient rehab remains this foundation of what we do in our specialty. But I do think that it's our responsibility um, as current physiatrists to really improve the residents' interest in inpatient rehab. And I think there's several ways you can do that. I think it's important to expose trainees early in their training and really emphasize the profound impact that inpatient rehab has on patient lives. And I think emphasizing the intellectual challenge of inpatient rehab can also be really important. I think sometimes we can feel like that there's not the diversity that you see in an outpatient setting, but it does take a lot of problem solving and really putting your thought into what you can do best for your patient. And so I think as long as we're, as a specialty, really supporting the inpatient rehabilitation side of our career, that we will see residents remain interested. And I think some of the things we're going to talk about in the tech and technology talk will also really be exciting for residents. I think, they want to see these new technologies implemented and used, and it can be really inspiring to them to know that, hey, I can do this in an inpatient setting too.
Amazing. I was just going to say that. I was like, your talk is perfect for all the ways that we can inspire people. And the ACGME is also coming out with some recommendations of getting PGY4s to be required to come back to do an inpatient month, which I've personally found has been a more profound experience for them when they've read through their board review materials, read through kind of the classical textbook, and they have a great knowledge base. They're like, this is a lot more intellectually stimulating. I know what I'm doing. I'm not doing everything algorithmically. So I've always found it to be a lot more fun. Of course, I've got to convince them early to kind of do what they're doing, but maybe if they go to your talk, they will be inspired early. Now, I know you're obviously involved with the AAPM&R, 2 talks this year, which is amazing. What do you want the residents and students to know about the AAPM&R as being one of the more premier places of premier conferences, excuse me, for them to attend?
So I think the AAPM&R conference is an amazing opportunity to connect with your colleagues, exchange ideas, and really be inspired by the innovations that we're seeing in physiatry. So I would hope that residents really come to the conference with an open mind and really even look to attend like sessions that they may feel like is outside of their comfort zone. I definitely recommend taking up all the opportunities to network. I myself have networked at the conferences previously, and you never know when you're going to find that mentor that really helps you in the next steps in your career goals, or could even be like a potential employer in the future. So I think the networking opportunities are really phenomenal. And then I love to really see the mix of cutting edge sciences. I think that, just when I think, oh, wow, I've heard about a lot of the topics, or I know what's going on in the PM&R world, something new and exciting is happening. I remember hearing a talk, maybe it was 2 years ago, about cryoneurolysis and how it can be used in spasticity. And now we're seeing it, more mainstream. So I definitely think keep your ear to the ground, look for those new technologies and innovations. And overall, I think you're going to have a really fun experience at the conference. It's also a time to go out and have fun with your other colleagues. So make sure you build in some of those opportunities during the conference.
Absolutely. I love the AAPMR. So much fun. I always tell my residents and students, just bring a buddy, because I'm a shy person. I may not want to go and network by myself, but if I have a friend that is there to kind of hold my hand metaphorically, then you're going to go and ask a question, meet up with somebody. And it's been so much fun, so many social events. And I always tell people at it, correct me if I'm wrong, but, just sign up for something, go and participate. Because the moment you participate in one thing, if you're a nice person, you work hard, I think people will give you more opportunities. And then you'll realize why the APMR is fun, because you get to see all your buddies from all over the country. So, and now I've made a new buddy. So I'm looking forward to seeing you at the conference and seeing your great talk as well. Or great talks,
Wonderful.
excuse me. Yeah. All right. That is all for our podcast or video. for today. I encourage everyone to come to the AAPM&R. I'm biased because I'm an inpatient doc, so I think everyone should show up at least on Thursday morning. There's 3 great talks, including 2 by our speaker today. Hope to see you all at the conference, and we will all say hello. Thank you.